Afternoon. Really? That picture, Mark? Thanks. It's my pleasure to introduce our speaker today. Mike Wilterwood has been the CEO of Enloe Medical Center for 11 years now. It's not an easy job. 3,560 employees, hundreds of physicians. It's a big, big job, and we're very lucky to have him. As you saw in the oak leaves, Mike has his master's degree in health care administration from Brigham Young University. He's also a fellow of American College of Healthcare Executives, and he is on the board of directors for the California Hospital Association. Prior to being named CEO at Enloe Medical Center, Mike was our chief operating officer, and he held that position in a number of hospitals across the country. So it's really nice to have a CEO that can not only drive the bus, but get under the hood if he needs to. And I think the community is very lucky. He's also somewhat of a local boy. He grew up in Lincoln. So Northern California kid, doing great. Please welcome Mike Wilterwood.
Well, thank you very much, Jolene, for that introduction. I'd also like to thank Katie Toma for the invitation. We are, I think, as a community, very blessed to have the healthcare professionals that we have. I'm going to try to give you a brief overview of what's happening with COVID. Everything it seems like it's 24 hours a day, COVID all day, every day, all the time. So some of these statistics you may be aware of, but I'd also like to give you some insight into the statistical analysis that we do to try and predict the surges that periodically happen or occur at the hospital, and some of the things that we look at, the help that we've received from the community, as well as some of the challenges that we're going to be facing over the next couple of months here, maybe the next 12 months or so. If we could go to the next slide. So you've probably seen a lot of these numbers. This is just Butte County only. We've had so far 1,238 confirmed COVID cases. 128 are currently in isolation with 959 recovered and 8 deaths. Now, the 8 deaths is really interesting because as you can see, as a percentage of the confirmed cases, it's not the striking ratio that we heard when COVID was first identified in China, where we thought that the death rate could be as high as 10, 15, even 20%. As many of you know, the death rate is related to the number of cases that have actually been tested and confirmed. And so as the tests proliferate, it would be natural to see the death rate go down
it's
somewhat.
On now. I'm on.
As a hospital, as an organization that needs to watch its resources relative to hospitalized patients, one of the things that we look at is not just confirmed cases, but what percentage of the population at any given time is going to require hospitalization, particularly intensive care. We don't wish COVID on anyone, but for us, the important numbers are the numbers of people that have been hospitalized. Now, you'll see on this slide that there are 8 Butte County individuals currently hospitalized. We also take hospitalized patients from Plumas, Colusa, Glenn, and Tehama County. I would say, roughly speaking, you could probably take all these numbers and multiply them by another 50% to get the total number of COVID-related patients that we deal with as an organization, except for hospitalizations. Hospitalizations from the surrounding counties have been more than double what Butte County has. And we've had currently right now, we have 8 8 hospitalized from Butte County, but we have a total of 17 cases that are hospitalized from all the counties that we provide service to. We've had our high water mark kind of following what we would call the 4th of July surge was about 29 patients. And so you'll see some of that in the fine print there. If we could go to the next slide. So we model based on statistical analysis. This just gives you an overview of how we created the model. And we look at worst case scenarios along with expected scenarios. And we base the hospitalization rate on some national statistics. You can go to the next slide. There you go. So this gives you a rough idea of tests versus tests that are positive versus tests that result in isolation. Now that's not hospitalizations. So from those isolation cases, we surmise the anticipated number of inpatients as well as the anticipated number of intensive care patients. And you can see how those pan out per county. Next slide. This gives you an idea of what how the new cases are unfolding. And you can see that the increase from June to July, if you look at that kind of third set of boxes, the increase in positive COVID patients on a daily basis went up 440% and in Butte County. And this is what put Butte County on the watch list. It wasn't the total number of cases, and it wasn't based on the number of cases that we would anticipate the health system could handle, but rather the rate of increase. And one of the reasons why the governor is looking at rate of increase is that he did not want California to be caught flat-footed the way New York was, where it wasn't.
Here, I'm on now. I'm on.
By the time New York decided to take severe action, the geographic curve was already in place. So next slide. This gives you an idea of the admissions and the demographic of the admissions, which also figures into the analysis that we do. You'll see over there in the upper right-hand corner, we talk about the length of stay, the non-ventilator length of stay, which is significant to us because ventilated patients tend to stay in the hospital a lot longer, and those kind of start to stack up and take additional resources. So we have to factor in the potential length of stay per hospitalized patients so that we can accurately predict the total number of patients that we might have at any given time. And you can see the demographics on the bottom left-hand box. So for folks that it's certainly people over the age of 55 are much more likely to be admitted based on their COVID positive test. The younger population is not immune from hospitalization. Next slide. This is a very interesting statistic, and we use this in our modeling. Whenever we know that there are social gatherings taking place, particularly holidays, we can anticipate a spike. And so you can take a look. We not only use local data, but national data in our predictive modeling. And you can see how we match up the date of the occurrence with the potential impact, which typically plays out over the following 2 weeks. So if you look at the high water mark there for Butte County of 227 COVID positive patients in isolation, that was a direct result of the 4th of July. And you can see We've expanded our services, which has had an impact on the number of positive cases, because as we've expanded services as an organization, we've provided more testing. So you can see how all those things kind of lead to increases in the number of identified positive cases. Next slide. So this is one of the more sobering statistics that we look at, and it's related to patients that are in skilled nursing facilities that might test COVID positive. And you can tell right away that, and you know, we would all assume that nursing home patients are very, very much at risk for intensive care admissions or requiring ventilator care. But 53% of the total deaths that occur nationally are nursing home patients. And so, again, while the last thing we would want to see would be any patient getting COVID, our main concern is to protect those that are immunocompromised or elderly or otherwise susceptible to severe hospitalization as a result of getting COVID. And you can see some of the how we've looked at our scenario planning. We based that on other states, and we have their average along with some of their worst case scenarios and our actuals, which helps us in our predictive modeling. Next slide. So this is a little dated, a couple of weeks old, but it gives you an idea of the demographic. And as Val pointed out, there has been a tremendous increase in COVID positive patients that are what you might call in the younger demographic. And what we have found, unfortunately, is while the incidence of COVID amongst the younger demographic does not necessarily translate to hospitalizations, which is good news, for some reason, we've seen that the increase in that younger population also seems to result in an increase in hospitalizations among the elderly and the immunocompromised. So for those 18 to say 34-year-olds who believe that if they get COVID, there's no adverse impact, what they have to remember is that they can be infected and carriers for up to 14 days before they become COVID positive, either through testing or they exhibit symptoms. And in the meantime, they're acting as carriers, which seems to have an impact on the population that is vulnerable. Next slide. So this is just some detail on our predictive analysis. I think we've probably gone over that enough. Next slide. So this kind of gives you an idea of the results of our predictive modeling, what we anticipated versus what we actually experienced. And I have to say that the model so far has been very, very predictive for us, which has been great because it's allowed us to allocate resources several weeks in advance of any spikes that we might see. Next slide. And keep going. Those are just other models. Next slide. So there's the predictive analysis overlay. Now, just so everybody knows, oh, go ahead. You can go to the next slide. Thanks. Next slide. So our preparedness, just so people understand, we're licensed for 298 beds, but we can flex up to 485. Some of that would be converting our inpatient rehab facility or even our behavioral health facility into COVID only. So we've got quite a bit of flex. And when you consider that 29, our high point for COVID-related admissions was 29, you can see that from a bed capacity standpoint, we have a lot of flexibility. Now, our current census is typically over 200. We were down to about 130 to 140 patients per day when we were delaying or deferring elective procedures in order to stay prepared for what we at the time assumed in March and April was going to be a severe surge of COVID patients that never occurred. And then you can see our critical care capacity as well. So from a bed standpoint, we've got plenty of capacity. The problem with a huge sudden spike in COVID patients will probably never be the real estate, the beds, or even the ventilator capability, but rather keeping our staff healthy so that they can take care of people and making sure that we have plenty of lab testing and protective equipment available as we move forward. And I'll talk about that a little bit more in a minute. Next slide. So these are all the things that we've done to prepare. We have since actually put a modular building on our campus to free up the main lobby of the hospital that will be used as a COVID screening center. We were doing that early on in tents, but inclement weather, too hot, too cold, too rainy, has been a problem for our employees as well as our patients. And so this modular building is temperature controlled. We can also set it up so that it has negative air pressure to reduce the spread of infection from an airborne standpoint for people who might have respiratory problems. And so this will help keep people with COVID type symptoms separate from people who are coming in for surgery or have maybe other emergencies that are non-respiratory related. Next slide. Okay, we've, just like every other business, I mean, we're instituting our masking policy, and we've got plenty of communication. We have communications 2 or 3 times a day to make sure that, resources are allocated appropriately. We're using our personal protective equipment and working with vendors in an appropriate fashion. Next slide. We've had a lot of support from our local congressman, our assemblyman, James Gallagher, Senator Jim Nielsen, as well as the governor's office. We get phone calls from them fairly frequently, making sure that we've got the resources that we need. There have been, quite frankly, some disconnects with some of the bureaucratic agencies that we deal with, such as Cal OSHA and the California Department of Public Health, not being on the same page with respect to the use of personal protective equipment and recommendations for lab use and isolation. But, we're working through those. We've got a lot of smart people in the hospital, and we're going to do what it takes to take care of our community and make sure that our patients and employees are taken care of. And we're going to do what we can to help keep businesses open in the area as well. And we communicate quite often. We felt that the healthcare system in Butte County, all of us that are involved in the other, including at Orville Hospital and Orchard Hospital, as well as the nursing homes, we felt that we were still in good shape to manage without completely shutting down our businesses again. But we kind of got overturned on that. As we mentioned, we are looking at healthcare related resources for patients who require hospitalizations and not the number of COVID patients. But of course, there's a lot of reasons why the governor's office is using different metrics than we are. But we do owe a lot of appreciation to our representative elected officials. Next slide. And there are just too many people to thank that have helped us with, just providing morale boosts of food. We have had a couple of folks that have donated very vital protective equipment to us, and Sierra Nevada Brewery has helped us with lab capability. Dan Gonzalez at Fifth Sun secured about 300,000 ear loop surgical masks for us, which just came in the nick of time. And just so you know, the utilization of masks has just been overwhelming, and it's been difficult to stay on top of it. Just to give you an idea of the most efficient mask is called an N95. It's a certain brand. Actually, it's got a certain model number. It's called an 1870. In a normal flu season, we might go through 150 of those masks, and we're going through thousands of those in a month, and we're going through thousands of those now in a month. The ear loop masks, we've gone through 250,000 in the last 2 months. And so the cost of these masks has gone. For the ear loop masks, we used to pay 3 cents a piece. Now we're paying 50 to 75 cents a piece. The N95 masks used to cost us 50 cents a piece. Now they're costing us $5 or more. And so hope you just take a minute to look at all these folks that have supported us. And, we make a lot of the really the truly brave people that are taking care of COVID symptomatic patients, both as first responders and as in the hospital. But the real support that we get from the community is overwhelming, and we couldn't do it without all your help. Next slide. This is some of the bad news. This is a little bit of a busy slide, but it just shows you how the drop in volume that we experienced in actually even March, April, May, and June, as we ramped up for COVID surge. And we lost an awful lot of money during those months. But you can see ED visits went down 43% in April. The revenues were down 20 to 50%, depending on the service, and the operating margins you can see at the bottom. You can see the difference between the national and the local impact. Next slide. This is also just change in prior year, just to give you an idea. Kind of an interesting dilemma that we have right now in our forecasting is post campfire, we had a tremendous increase in business volume. And then post COVID, we've had a real downturn. And, where we're going to kind of even out is anyone's guess at this point. Is I'm sure our county has lost a number of, some of its population, and some businesses have unfortunately had to close as a result of the campfire, and COVID is just another layer. So as with all businesses in the area, we're taking a look at strategically is how do we position ourselves efficiently and sustainably in the future, depending on how utilization pans out and our population pans out. Next slide. This just again gives you it's a busy slide, gives you a rough idea. I can tell you that bottom line, even after some of the federal assistance that we received, we're looking at an operating loss of about $28 million year end in fiscal 2020. And we're hoping that we can minimize the losses to about $1 million a month over the next few months while we try to figure out how to stabilize the operations. Next slide. Again, a little more financial reporting, but those bars give you an idea. about 68% of our inpatient admissions comes through the emergency department. You can see kind of 2019, we had this post-COVID or campfire spike of 76,000 ED visits per year. We finished at 71,000 for 2020, but you can see in March the tremendous drop that we had in emergency room visits. And so part of our message is to make sure that people don't delay care, or especially emergency services, because of the concern over COVID. We really need people to get in and address some of their urgent and emergent issues early, so that it doesn't cause any undue stress on their health, in the worst case scenario, lead to a death that was avoidable. Next page. One of the, just kind of to leave you with this, we're doing a lot of testing, and unfortunately lab testing there's still a national shortage. And so you may hear in the community that some people have been waiting extraordinary times for their lab results. This is just unavoidable. I mean, we only have a handful of tests that we can run ourselves based on the supply of lab kits that we can get. And those have to be reserved for emergencies, particularly people that are going into surgery, so we can identify those that may be positive and take appropriate steps to isolate them. But you know, we're trying to maintain our other services, particularly surgeries, and lab testing is integral to our ability to do that. So if you don't have an urgent or emergent need, often these tests are being provided by LabCorp or Quest, which are basically send out labs, and these labs sometimes get backlogged, and it'll take, you know, sometimes you can get your results in 72 hours, sometimes it takes 10 days, and it's just kind of a roll of the dice, unfortunately. Next slide. This is just a busy slide. It just talks about some of the utilization rates and some of the things that we're trying to do to increase lab testing capability. But we are working with Pathology Sciences Medical Group as well as the county to try and get more reagent deliveries to the area. Next. And then this is just, you're not going to read this, but this is a daily report that we get on all the kinds of protective supplies that we have. It's kind of a stoplight report so that we can identify where we might be running short and where we have to exercise some discretion into how those supplies are being used, or whether or not certain services can be performed. So far, since June, we haven't had a situation where we've had to delay services due to lack of protective equipment. But you know, it's a daily a lot of work for us to make sure that those that we get those supplies from the appropriate vendors, and that those are disseminated appropriately throughout the organization. Next. Thank you. I don't know if anybody has any questions. I know that was quite a data dump, but want to reassure you first and foremost that we're in a good spot as an organization. We've been able to maintain our normal levels of service the last couple of months. And as long as we can stay healthy and keep up our supplies of labs and protective supplies and equipment, we should be in good shape. And the nursing homes and some of the other areas that take care of particularly vulnerable people, people that are immunocompromised, are doing a really good job. Our medical staff works closely with them to make sure that patients who test positive in those areas are isolated properly and get the proper care. Any questions?
I'll tell you what, Mike, we're at about 1:35, so I'm going to suggest that folks that have questions send you an email at mike.wilterwood@enloe.org. Thank you very much for a great presentation. Great information. You know, it's nice to see things that I know I can trust up there. And Mike, we are going to make a donation in your name to Rotary Centennial Park, the park that we're putting together on Ceres Avenue. Again, thank you very much for the presentation. It was fantastic. So
Yes, sir.
Rotarians.